Hi, my name is Andrea and I will be presenting on hepatitis. Hepatitis is classified as an inflammation of the liver. It is caused by viral infection in most cases, but there are other causes. Other causes include toxins, drugs, alcohol, and autoimmune disease. Hepatitis A is the type that is most commonly transmitted by consuming food or water contaminated by feces from a person infected with hepatitis A. Hepatitis B is transmitted through contact with infectious body fluids such as blood, vaginal secretion, or semen containing the hepatitis B virus. Injection drug use, having sex with an infected partner, increases a person's risk of acquiring hepatitis B. Hepatitis C is transmitted through direct contact with infected body fluids, usually through injection drug use and sexual contact. Hepatitis D is usually contracted through direct contact with infected blood and occurs in conjunction with hepatitis B. Hepatitis E is a waterborne disease, and we see it mostly in areas with poor sanitation. According to Centers for Disease Control and Prevention, approximately 4.4 million Americans are currently living with chronic hepatitis B and C. Between 2012 and 2016, the number of hepatitis A virus infections fluctuated because of large outbreaks. Between 2012 and 2013, it was due to a large multi-state outbreak associated with pomegranate aerosols imported from Turkey. In 2015 and 16, we saw reported cases again increase by 44.4%. Both were linked to imported foods. Since the 1990s, with the widespread introduction of hepatitis B vaccine, there has been no consistent trend in acute hepatitis B virus cases. Reported cases of acute hepatitis C virus cases increased from 2010 to 2016. It increased 20.2% from 2012 to 2013, increased 2.6% in 2014, 11% in 2015, and 21.8% in 2016. The increase is due to rising rates of injection drug use. We also see that there is a decrease in hepatitis A and B because there are vaccinations available for hepatitis A and B. However, we see an increase with hepatitis C due to greater injection drug use. And then on this chart, you can see that hepatitis A has gone down and B has decreased both greatly. However, on the yellow one, that's hepatitis C, has increased due to sharing of injection drugs. Chronic hepatitis B or C can often lead to more serious health problems because the virus affects the liver. People with chronic hepatitis B or C are at risk for chronic liver disease, cirrhosis, or liver cancer. When your liver stops functioning normally, liver failure can occur. Liver failure includes bleeding disorders, a buildup of fluid in your abdomen, increased blood pressure in portal veins, kidney failure, hepatic encephalopathy, which involves fatigue, memory loss, diminished mental abilities. Liver cancer and even death can occur. People with chronic hepatitis B or C are also encouraged to avoid alcohol since it accelerates liver failure. For symptoms, if you have infectious forms of hepatitis that are chronic, like hepatitis B or C, you may not have symptoms at the beginning. Symptoms don't occur until the damage affects the liver function. Signs and symptoms of acute hepatitis include fatigue, flu-like symptoms, dark urine, pale stool, abdominal pain, loss of appetite, weight loss, yellow skin and eyes, known as jaundice. For treatment of hepatitis A, there's usually no treatment since it's short term. However, there's a vaccination available that can prevent this infection. Most children begin vaccination ages 12 and 18 months. There is also a vaccination for hepatitis A that is available in combination with hepatitis B. For acute hepatitis B, it doesn't require specific treatment. Chronic hepatitis B, however, requires treatment of antiviral medications. Hepatitis B can also be prevented with infections that is in a series of 3 vaccines. Antiviral medications are used to treat both acute and chronic forms of hepatitis C. People who develop chronic hepatitis C are typically treated with combination antiviral drug therapies. Liver transplant may also be necessary if a person develops cirrhosis, and there's currently no vaccination for hepatitis C. There is no antiviral medications that exist for treatment of hepatitis D at this time. However, you can get the hepatitis B vaccination since hepatitis B is necessary for hepatitis D to develop. And currently, there's no specific medical therapies that are available to treat hepatitis E. It usually resolves on its own since it is acute. For preventative methods, practicing good hygiene is one key way to avoid contracting hepatitis A and E. If you're traveling, you should avoid local water, ice, raw or undercooked food, raw fruit or vegetables. Hepatitis B, C, and D are contracted through contaminated blood and can be prevented by not sharing drug needles, not sharing razors, not using shared toothbrushes, not touching spilled blood. Hepatitis B and C can also be contracted through the sexual intercourse and intimate sexual contact. Practicing safe sex by using condoms can help decrease the risk of infection. The use of vaccines is also an important key to preventing hepatitis. Vaccines are available for hepatitis A and B. Then here are the two online sources for extra info that I found, CDC and hepeducation.org. Here are my references, two CDC references, and a couple of articles that I found on the Cal State University website. Then the first one, CDC, has hepatitis A, B, C, D, and E, and it includes all these subpoints that you could take a look at. And then for the next one that I found, hepeducation.org has information on hepatitis A, B, and C. And you can click on each to get more info. It tells you what it is. And then also gives extra info that you need to know, such as preventative methods, transmission, risk factors, symptoms, vaccine, treatment, and that's about it. Thank you.